Good morning, everyone. Could you just pop the time on the board, please, Mandy?
Yeah.
Can we just review the actions from yesterday, please? So, Dawn, book formulation for AP.
Yeah, formulations booked, that could come off.
Discuss with Dr. Harris.
Yeah, we didn't discuss with Dr. Harris yesterday, but we've got a meeting after the huddle today, so that can come off.
Do you want me to take that off?
Yeah.
And can I just remind everyone, for the reviews, could you contact Susan and let her know when they're coming up, when the CPA reviews are coming up, so that she can complete the swim webs? Thank you. Okay, so can we now report on the patients you've seen in the previous 24 hours, please? Dawn, would you mind starting?
Yeah. First of all, yesterday I saw Rose Smith. We're just working through the 12-week model line process. She's been engaging really, really well. And the next step's the recovery star. I went to see Kevin Taylor. We revisited the discussion about family work, and his family are now ready to engage with BFT, so the task yet to refer for BFT. Went to see Chris Brown. He's completed the 12-week model line process, and the plan was to increase his daytime activity, getting him engaged in some community groups. Initially engaged really well, but has now been avoiding appointments and not really attending the community groups. So it was just some help with the next step, please.
I thought we could do a cat formulation for him. So I thought that last time. So I guess the first step would be for us to meet together to discuss that as a possibility.
That's an option, yeah. Yeah, thank you. And I went out to see Emma Bailey to do her depot injection. She's doing really, really well. No other work required at this time, so next step, 2 weeks depot. And that was me.
Yeah.
I saw Peter Dickinson, and that was for his initial OT assessment appointment, which is model line pack 20. The plan is then to continue that assessment at our next appointment, which I've made for next week. The one concern I had was that, based on the information that the care coordinator had given me prior to me going, I think there was some relapse indicators there, but I've already discussed that with the care coordinator for them to follow up.
Okay.
Then I saw Carol Mason, and that was to continue with her OT intervention. That was model line pack 20. The next step is to arrange a joint appointment with her allocated social worker, as social care needs are now reducing with the OT intervention. So that's something we need to plan.
Yeah, and I'm a social worker, so I'll do a joint visit with you with regards to reviewing and looking at a Care Act assessment, and I'll put.
Yeah. And have you got a couple of minutes after this for us just to put that in our
diaries?
Well, right. So we don't need it on the board. We'll meet up after this to put that in place. But that's the next step with her.
I saw John Gunn yesterday. He attended for his planned depot. He's recently seen Dr. Wise, who increased his procyclidine because he was feeling restless. So he's currently on 5 milligrams twice daily, but he's still feeling quite restless. So I'm just wondering, Helen, if to book in an appointment with you.
Fine, yeah, book him in.
And then I escorted Jane Smith to the Motion Project. So the plan is with Jane that we're trying to get her out of the house more because she's drinking and she drinks in the house. So she's indicated that she doesn't want to carry on with the Motion Project. However, we looked at maybe the ladies group, and I think she would feel more comfortable with that. Also, she was attending an art group in the community, and she's not finding that really fulfilling her artistic needs. So we were looking at other courses. I've got a prospectus to take out to her next time we go out there. And with regard to the alcohol, we're just promoting the local alcohol service. So to give her some support with that. Any issues for the leadership team?
We've just noticed recently that we've been requesting medic appointments. Seem to be a bit of an increase in the wait times, if that can just be discussed.
Yeah. Anything else for the leadership team?
No. I just wondered whether that ECG's being done now, Dr. Harris, or whether he will be able to have a look at that when you've got time.
See me afterwards. Yeah,
I'll put that down as a... Do you want that put down as an action then?
Yeah, why not?
Okay, so the last thing is performance, and the only issue we had outstanding were 2 missing swim webs, and that's because they were actually completed but outside of the allotted time. So can I just remind you that the SWEM-webs need to be completed either 2 weeks before the cluster or 1 day after.
Yeah.
Anything else, anybody?
No.
No? No? Okay, great. Thank you very much, everyone.